So good morning, everyone. Welcome both to this Fireside chat of the Access to Medicine Foundation. Today we're here to discuss the topic of responsible manufacturing and how pharmaceutical companies can limit the risk of AMR for manufacturing. Because when antibiotics are manufactured, typically antibiotic waste is released into the environment, typically in rivers, and here it can really drive resistance, but also harm the environment. And I think this is an overlooked driver of AMR, so I'm very excited to discuss it with you two today. But before diving in, I would like to give you the opportunity to give a short introduction of your work and who you are. So Maggie, maybe we could start with you.
Yes, so my name is Magdalena Kettis and I work in the responsible investment team at Nordea Asset Management. Nordea Asset Management is one of the largest investors in the Nordics. I'm based in Stockholm, Sweden. We're very pleased to see this report being published. Responsible drug manufacturing in AMR has been a focus area for us since 2016. And we have engaged in a very constructive dialogue with the pharma industry on this. And since 2018, I'm on the industry-led pharmaceutical supply chain initiatives advisory panel. And I was also on the expert committee for the AMR benchmark for a couple of years and pushed for the inclusion of criteria to environmental impact of manufacturing, discharge of antibiotics. And we are now members of the investor action on AMR. So we're continuing this work.
Thank you. Eirik?
Yeah, thank you. My name is Eirik Sverrisson. I'm project manager for the Norwegian Hospital Procurement Agency. I'm an economist with a broad background from pharma. I've been a marketing director for Norway's largest pharmacy chain, and I've worked as a consultant. For the last 6 years, I've been heading up the team procuring all generics and biosimilars for all the Norwegian hospitals, as well as a chairman for the procurement group in the Nordic Pharmaceutical Forum.
Thank you both for being here and sharing your experience. I think it's really interesting to have someone from the investor side and someone from the procurer side as different stakeholder groups who are engaging with pharmaceutical companies on this topic. And I would actually like to know a bit more about this. Maggie, could you explain how you've been engaging with pharma companies on this topic, the progress you've seen over the years, and how you've been stimulating companies?
Yes, of course. So we started engaging the pharma industry after a trip to India in 2015. And during that trip, we saw some very disturbing evidence of pharma pollution in the waterways and surrounding communities, surrounding manufacturing sites. And then following that, we commissioned an independent on-the-ground investigation of pharma manufacturing sites in Hyderabad area. The evidence in that investigation showed that the situation on the ground was very serious. And the investigation team saw manufacturing sites and systematic dumping of effluent in rivers and waterways around these sites. And of course, with very negative impact for the surrounding communities. They also identified a number of Indian suppliers and tried to connect them with big pharma companies. And the report also, and the findings we did publish in a report, and that report also pointed to the lack of transparency in the pharmaceutical supply chain and how it's very difficult to track this, and trace pharmaceuticals from pharmacy shelf to factories, and also link different companies to suppliers. So when we had the results of the report we shared them with a number of companies in our portfolio, and we asked for confirmation from these companies as to whether they had any business relationships with these suppliers mentioned in the report or not. And then we also shared the report with the Pharmaceutical Supply Chain Initiative. And following that, we were invited to one of the PCS annual meetings. And I think about 30 companies were present at that meeting to present our expectations and also some, discussing the findings of the report. Our expectations, they included that the industry take a kind of industry approach to this problem, that they would commit to protecting the water resources in India, and that they would also engage in capacity building of Indian suppliers. We also commissioned follow-up report or follow-up investigation where we included water sampling and also published that report and shared with our portfolio companies. And then in response to these findings and our discussions with the industry, they agreed that in order to achieve structural industry change, industry level commitment was necessary and also industry action. And they decided also that they would develop an action plan to address our concerns and findings in the report. So we've been engaging with the Pharmaceutical Supply Chain Initiative since then, and also had individual engagements with companies. And many of them have, of course, confirmed that they're taking direct actions for their suppliers. Well, I mean, since we started engaging, the Pharmaceutical Supply Chain Initiative has grown to more than 70 companies, and they address many of our, concerns and our expectations, and our expectations have more or less been met. But since AMR continues to be one of the global, the biggest global risks that we face, and we want to continue to engage the industry on this issue, partly through the advisory panel that I'm a member of in the Pharmaceutical Supply Chain Initiative, but also in other ways, such as the access to medicine that we are a signatory of course, and try to engage in other on other arenas as well and initiatives.
Yeah, that's a lot, and it's also interesting to hear that in the first meeting there were only 3 companies, and now with the PSCI, how many companies have joined and how much?
No, not 3, but 30.
30. Oh,
30.
Yeah. Oh, that's a good point. Yeah.
Yeah.
Because I
but
think.
Yes. So no, we see a lot of progress. We do. So we're happy about that, and also the opportunity for us to be able to participate in industry meetings is, of course, very valuable.
Yeah, and especially since 2016 that you already started, because I think that was a big starting point for AMR, where a lot of awareness was grown to AMR as a global health problem. And I think it's noteworthy that a lot of the progress is on a voluntary basis from companies up till now, because there's no real regulation, and there's been a lot of regulations discussions. But I think another topic, and I think maybe Eirik could tell us more about that, is instead of putting regulation in place, you could also start rewarding companies that are doing really well when you start buying from companies. So, Eirik, could you elaborate a bit more on how you've been engaging with companies and how you try to stimulate companies to manufacture more responsibly and limit AMR?
Yeah, definitely. It evolved from our strategy process in 2018, as well as observing that we had fewer and fewer suppliers of these crucial products into Europe. In many areas, we had none left, so we were forced to buy unlicensed products. And we saw that pollution, of course, was getting worse, but also our out-of-stock problems. So it seems to be connected also with the lowering of prices. The tenders in Norway and most other countries had been originally only on price, and that keeps driving the prices down. And the originator producers sell off, and the production goes to cheaper and cheaper countries, and they, of course, maybe have looser criteria when they produce. So we thought that using more criteria than just price, so using meat criteria, as it's called in EU language, could help, and environmental criteria was one of those. Where we look into the pollution from the production and the whole supply chain picture comes into the tendering. So we developed the first criteria with the industry and have continued to develop it with the industry through dialogue. And this has been very positive. And what we have done then concretely, for instance, on antibiotics, is that price only accounts now for 25% of the tender. Environmental criteria, for instance, are 30%.
Yeah, and did that, because you can also maybe think of there's like a fear if you start to ask more from companies and add more criteria that they will leave the market, and it's actually a risk for access to antibiotics. What was your experience? Did it increase competition and secure supply, or did you see companies moving away?
There are several aspects to it. When I started in 2017, we were like most of Europe. We procured on a local level. So it was more or less a hospital per hospital contract. We quit that and made it regional and then national. And now we're doing multinational tendering on those to get a better contract as a basis for negotiation. But we see that criteria is the only way to raise the price level. If you want to buy a better product, you have to be able to give them a more fair price for it. You don't, you can't keep driving the price level down. So that was part of it. Using the criteria, having more volume behind it, so that you know that the production that you produce will be purchased, and that required also then longer contracts. So instead of like they do in Sweden, where you have monthly by monthly contracts, in Norway we try to have 3 years, so that you know that the production you have done is sold. So you don't have a lot of waste there also.
Yeah, that's interesting to hear. I think both of you are already saying that there's a lot of progress and you have positive experiences in engaging companies on this topic. I'm also curious, and this is an opening the floor to both of you, but I'm wondering, what do you like to see more? Because we've seen a lot of progress by industry, but what do you think companies can do more, and what opportunities are there to manufacture more responsibly and limit the risk of AMR? Is there anyone who wants to start?
Yeah, I can start. I think a good start would be entering AMR Industry Alliance's homepage and look into the production criteria published there and see where do we comply and where do we not comply. It has a lot to do with what you know of your total production system, both in-house and what you procure as a producer. And then get into dialogue with the markets to try and see what can be done so that you can have an incentive also to produce a better product. Can you get a better payment for it also? And the old plain, so to speak, antibiotics, in Norway, we are very fond of using them, and not all countries are that, but there could also be more development in those production products to help industry have more revenue from them. In the US, you have a lot of ready-to-use products. In Europe, we're still on vials, mixing at the clinic or in front of the patient or at home. That seems a little bit yesterday. You should be able to have ready-to-use products, and we should be willing to pay more for those.
Yeah.
No, I agree with Eirik that engage with the AMR Industry Alliance and of course the AMR Benchmark Access to Medicine Foundation and also the Pharmaceutical Supply Chain Initiative for best practice. And I have a question for Eirik, if I may.
Yes, go ahead.
Yes, I would like to hear your view of the new AMR certification that was released by AMR Industry Alliance and
BSI.
Recently, and BSI, yes.
Yeah, and we were on the launch event together with both of them, presenting our reviews, and we are extremely positive. We think this is a good way to start demonstrating that you have control of your whole production chain. And we would love to see more companies. And I spoke to Courtney in BSI last week, and she reported great figures of companies contacting them to know more about how can they be certified. And we will incorporate that in our tenders so that you will be able to say, check, you have a green, so to speak, product, and thus you will be able to have a higher price than the non-green, so to speak, product.
Oh, it's excellent to hear. Yeah, thank you.
So we're actually working on all 5 Nordics to implement those same criteria in all 5 Nordic countries before we take on the rest of Europe and try to push them into a similar thinking together with everybody that wants to listen, because we think this is a strong foundation to build on.
Yeah, no, I agree, absolutely.
And Maggie, do you have any thoughts on how companies can improve further? Because they've done a lot themselves, but are there opportunities you see where they can push a bit more, or any thoughts?
No, I think that the dialogue with suppliers is very important. And as I said, I think there are excellent organizations or initiatives to engage with and learn more about best practice. Yeah, and of course, also the dialogue with procurers is of course very important as well.
Yeah, it's really a multi-stakeholder effort.
It is absolutely, yeah.
Yeah, I just wanted to insert that regrettably, very few on our side of the table procurers in Europe use meet criteria on procuring this. They only use price still.
Yeah.
And I think that will be part of the problem, and hopefully they will turn around and utilize the full toolbox that we have as procurers to do more, because we should cooperate in areas like TB drugs, which is on the rise again, children products, antibiotics, because even the Nordics are not big enough to warrant a full batch of children products being produced for these narrow spectrum antibiotics because the volume is so low.
Yeah.
But if we procure many more countries together, these important products, then we could maybe get someone to produce them.
Yeah, you get some volume, yeah. And I think, Maggie, you addressed a good point, because we see a lot of progress from companies with their own manufacturing sites, which they have a lot of control over. But I think maybe the majority of all the active ingredients are produced more upstream in the supply chain. And without regulation, I think it really, it's a unique place for companies to try to work with their suppliers and get them on board as well. Maggie, I was wondering, because we've been talking about access to antibiotics and responsible manufacturing, both. Is that also something that you look at when you engage with companies, that connection between the two?
Sorry, what was it? I couldn't hear you. The connection between
ensuring access to antibiotics, but at the same time making sure that when these antibiotics are produced, that they are produced in a responsible way without leading to AMR.
I mean, that is part of the analysis. Yes, I would say that. Yeah. And also good questions to ask companies when we interact with them.
Yeah, that makes sense. Yeah, because last week, indeed, you mentioned it already, Maggie. The Access to Medicine Foundation published a report on what pharmaceutical companies can do to manufacture responsibly. And with the report, we're setting expectations on what companies can do, but we also really try to highlight examples of what's already going on, and this way try to stimulate other companies like suppliers to take this issue on as well. And in line with the discussion we have here with procurement, investor, we also see that the landscape is changing a bit, and way more stakeholders are looking at this, and therefore it's not only becoming a moral obligation or a moral responsibility for companies, but it's also starting to become a business priority. And with Eirik already said, there are now companies winning tenders because they are manufacturing in the most responsible way. So that already is a great reward to see there. I was wondering if you have any other points you want to bring in, or any other questions from your end.
I would really recommend that everyone reads the report. I think it was very good. I think there were very good examples, and the case studies were excellent. So I think there's a lot of good information in there.
Thank you. Yeah, we really try to look, because there are standards from the Industry Alliance, but I think there are a lot of expectations also from academic experts that maybe go beyond the standards of the Industry Alliance to limit AMR. But as we said before, if companies are not moving on a voluntary basis, nothing happens. So I think it's indeed a great starting point to push further and to see how we can ensure access, but at the same time, manufacture responsibly, not leading to AMR, but also not harming the environment. And I think I have a lot of questions for you still, but I think we should close the discussion here. And I want to thank you for sharing your experience. And it becomes even more clear that companies have a key role to play, but I think everyone has some way of stimulating companies to do more in manufacturing responsibly. So thanks again, and I look forward to keep following your work in the near future. So thank you very much.
Thank you.